Assalamu alaikum. This is Uzaf Ahmed Shabir. I will be discussing the case study of uterine inertia in Flemish giant rabbit presented at Peru University, published in Society of Theriogenology. Moving on to the case introduction. So this is the case study of 1-year-old female Flemish giant rabbit, and it is her first litter. The case history was presented as 3 viable kids at home and there is no further delivery since 48 hours. Upon physical examination, there was restlessness, straining and hemorrhagic discharge from the vulva was seen. The heart rate and respiratory rate was normal, but the peripheral temperature was slightly lower. Abdomen was pendulous and strong contractions was felt. Moving on to the diagnostic findings, ultrasonography and radiography was performed. Upon radiography, it can be seen in the pictures that there are 2 fetuses in the abdomen. One fetus is near the pelvic inlet and there isn't any obstruction. And the gas opacities over the fetuses are evident that they are dead. So, for further clearance, the Doppler ultrasonography was performed and it was seen that there is no heartbeat. So, the final diagnosis is uterine inertia in unobstructed birth canal with 2 fetuses. Before discussing the treatment and management of the case study, I would like to give you the theoretical recap. The dystocia in the rabbits is not uncommon and it contains 2 factors, either maternal or fetal. The maternal factors include pelvic abnormalities, uterine inertia, and obesity or maybe hypocalcemia. When it comes to the fetal causes, there may be fetal deformities, fetal malpresentation, malpositioning, and eventually fetal death. When it comes to uterine inertia, there are 2 main types, either primary or secondary. The primary uterine inertia is due to mechanical, hormonal, or maybe metabolic causes. The secondary uterine inertia is due to labor fatigue. So this is the case study of prolonged stage 2 and stage 3 of the parturition. Owner was advised for ovariohysterectomy, but he declined and opted for the medical management. Butorphanol 0.1 mg per kg. Subcut was given as the anxiolytic and analgesic, and 2 international units of oxytocin were administered intramuscularly for the contractions. Within 30 minutes, there wasn't any effect. The 3 more international units of the oxytocin were administered IM. The contractions were strong, but there wasn't any delivery. So, after 1 hour, 100 ml of the Normosol solution was given subcut so the moisture of the mucosa can be retained. Then 5 more international units of the oxytocin were administered IM, and within 30 minutes 1 dead fetus was expelled. The owner was advised to keep the patient in the hospital for critical care, but he declined. So the patient was discharged with meloxicam 0.23 mg per kg per oral repeated every 12 hours for 1 week, and an antibiotic trimethoprim sulfa 15 mg per kg per oral repeated every 12 hours for 1 week, and the patient was discharged. Now moving on to the prognosis of the case. 10 hours post discharge, the second dead fetus was expelled, which was normal in size and not decomposed. So the final litter are 3 live and 2 dead kids. The doe was recovered successfully with normal appetite and nursed the kids successfully, and the behavior was normal. So no further treatment is required. Now we will discuss the learning outcomes of the case study. So uterine inertia is the major cause of dystocia in the rabbits, and radiography and ultrasonography are very important for diagnosis. Repeated oxytocin can resolve the uterine inertia if the canal is unobstructed, and the butorphanol helps keep calm the animal without inhibiting the contractions. The early intervention and diagnosis are crucial for the fetal survival. That's it for this case study. Thank you.